If you are a pet owner, this story is for you. It's Monday today, the beginning of a brand new week. So let me ask you, how do you usually beat those Monday blues? A cup of coffee from your favorite cafe perhaps? Cooking your favorite meal? Exercising? Or if you have a pet, some snuggling with your furry friend? All pet owners would vouch for that as a great stress buster. After all, what could be better than taking a nap with your pet at the end of a long, tiring day? But what if the time you spend with your pet has a downside? And what if you are a threat to your pet as well? I'm sure you're wondering what I'm talking about. How could there possibly be a problem when it comes to spending time with your pets? Well, according to a new study, there could be. In what way, you are asking? The study has found that dogs and cats could be transmitting drug-resistant organisms to their owners. And not just that, humans could also be passing them on to their pets. But there is good news. As per the researchers, the cross-infection risk is low. Let me just tell you more about the study first. It involved 2,800 hospital patients and their pets. Dr. Caroline Hackmann from Charité University Hospital, Berlin, Germany, and her colleagues conducted this study. The organisms in question are multi-drug resistant. They are called MDROs. What exactly are these organisms? Basically, they are bacteria that resist treatment with more than one antibiotic. You see, they develop resistance against the very drug that is supposed to be fighting against them and kill them. In fact, antimicrobial resistant infections have been a growing cause for concern. A study earlier found that antimicrobial resistance has become a leading cause of death worldwide, that it's killing about 3,500 people every day. This new study involved collecting samples from around 2,800 patients who were hospitalized and also from any dogs and cats that lived in their households. 30% of the hospital patients tested positive for drug-resistant organisms. In those who tested positive for these organisms, the rate of ownership of dogs was 11%. The rate of cat ownership was 9%. More than 300 pet owners sent swab samples of their pets, and of these samples, 15% of dogs and 5% of cats tested positive for at least one such organism. Talking about the study, Dr. Caroline has said that although the level of sharing between the hospital patients and their pets is very low, the carriers can shed bacteria into their environment for months, and they can be a source of infection for other more vulnerable people in the hospital. For example, those who have a weak immune system, those who are very young or very old. But it's also important to note that this is an observational study. The researchers have said that it cannot prove that close contact with pets causes colonization with multi-drug resistant organisms. It only suggests the possibility of co-carriage, and the direction of this transfer is not clear. These findings will be presented at this year's European Congress of Clinical Microbiology and Infectious Diseases, which is to be held in Denmark in April. WION now available in your country. Download the app now. Get all the updates on the move.